At the John McGivney Children's Center, they're zeroing in on the true essence of empowerment, focusing on the enrichment of strength and providing a plausible game plan for success and prosperity. I had an opportunity to sit down with Elaine Whitmore, the executive director of the center, to discuss their core principles and see firsthand how they're helping abilities grow in thousands of children with special needs each and every day.
Certainly, the mission here is really to provide the support and services necessary for children with special needs, primarily physical, neurological, and developmental, to reach their full potential. It really is the mission to provide whatever they require so that they can enjoy their life and participate as a citizen in our community.
And can you tell me about the ongoing services and what it takes logistically to serve over the 2,000 families and young children that you service here at the JMCC on a regular basis?
Yes, we live off the work and the vision of the original board of directors and under John McGivney's leadership in looking at making sure we have that range of services available for these children. So when this center was first established, if we look back in the archives, and I've had the pleasure of looking through some of those original files, through some of these original letters, there was a tremendous amount of advocacy to the Ministry of Health, but also to the Ministry of Education, so we could have not only the clinical rehabilitation services here, but we could also have a school here, which only a few of the centers across the province have. So we continue that work to look at what additional services and partnerships do we require. And for example, recently we've taken on services and programs that provide support for children with autism and their families, a relatively new area of service for children's treatment centers. We've also partnered with the Windsor-Essex Community Health Center, and we now have 2 nurse practitioners who visit the center 1 day a week and help to provide primary care services for children who perhaps don't have a family physician, or if they have complex needs, the nurse practitioners can help coordinate all the care that's happening for these children and really be a help to the parents. We've also partnered with the Windsor-Essex Public Health Unit, and we now have the Ontario Smiles program on board here, which means that families who have lower incomes and really find it difficult to afford preventive dental care for their children are able now to obtain that here. That helps out our current population of children because while they're here for other services, they can book into that clinic. But it also opens our door to the West End community. So even children and families who aren't associated with our center can book in appointments at that clinic, and we get ourselves and our children better known out here in this West End community, and we get to really look for other opportunities to become good community partners.
For yourself, as the executive director of the center, can you talk to me about your personal inspiration you received from the students and staff here who work and come to school here every day?
Well, it's hard to keep a somber mood when you do come into the building. There's a lot of laughter happening here and a lot of hard work, both by the children in their therapy, in their preschool programs, and in the school programs, but also too by the staff who work so hard every day to assist the children. So it is truly an inspiration for those of us in the management team to continue to work hard with our ministries, with our funders, with our other community partners to make sure that we're bringing our all to the table and doing everything we can to make sure that services and supports are in place. But certainly if it's a day that you think you just don't have that energy, all you have to do is walk through the halls of the building and you are truly re-energized to go back and just pick up the task again.
And can you tell me how important it is to continue your vision here at the John McGivney Children's Center? Because I know that a number of parents sometimes struggle with coping with sometimes coming to the reality that their children have special needs. So how do you work with parents to sort of ease that burden or concern with their children?
Yes. that's a really important component of working with our families. It truly can sometimes be a grieving process for families who may have had an original vision of what their child might have accomplished, but certainly working with the full range of the therapy team in focusing on abilities and focusing on ways to allow a child to continue to reach their dreams is really an important component in just the day-to-day therapy. Certainly the early childhood educators in our preschool work on that and keep the focus on making sure that the abilities of a child are the key focus, and helping the parents to see just what their child can accomplish and how they can be assisting in that journey for their child. Our teachers in the school do the same, and we work with our community partners like our co-chairman school boards to make sure that we're bringing everything to the table and staying current. But it's certainly our social workers on staff as well, who often have a main leadership role in helping the families through coping and through stressful times. And they can certainly be an aid and an asset to the parents, but they help us as the staff also throughout the center to find those ways to be able to be of greater assistance to families who may be really struggling at points in times during this journey.
And can you talk to me about your slogan here of helping abilities grow? Can you describe the origin and why it's so important that you, as a staff here at the center, go by that slogan?
There was several years ago a rebranding process, so that was part of the whole process where we transitioned from the original name of the center, the Children's Rehabilitation Center of Essex County, to the John McGivney Children's Center. So in addition to the name change and the development of the logo of the tree, so again, the concept of always growing, we looked at the tagline of helping abilities grow. And again, it was a real focus on always keeping the eye on the abilities and not always seeing the disabilities. So with that in mind, it helps, I think, our community to understand what the focus is of the center. Helps us to engage partners when we have to do fundraising and when we have to look at broadening services, that really we are focusing on abilities, and we want your help to be able to allow these abilities to flourish to their full extent. And certainly that's the hard work that the children and the families are doing themselves, and it's sometimes that assistance from not only our staff but our community partners that help get the supplies in here, help support the programs and services, help get other recreational activities underway that allow us to just keep that push on and keep the focus on the abilities. One of the key ways I think that is really instrumental and is getting more attention now, which I think is great, is a real focus on recreation and leisure. Often we can become so focused on the tasks related to excelling in school and not really give the appropriate attention to recreation and leisure. And we've had some great partners come on to do that, such as the Junior Golf Academy. So we're running an adaptive golf program, which again just opens up the doors for that type of recreation activity. And also we'll have the commencement of Little Ninjas program as well too. That's been in place over at Windsor Regional Hospital for children who have survived cancer. And now we also are going to see the start of that program here. And I think what we all know is that often success in recreation and leisure can be a great builder of self-esteem, and that's certainly what we want our children to be able to carry with them throughout their life, is confidence and self-esteem as they move through to accomplish everything they will do.
And as your base of clients here at the center gets older, I know that recently your staff and your parents here are starting to develop sort of a transitional program for the older clients you have here. So can you tell me about that?
Yes, we've certainly heard, not only in our community, but I hear it through my colleagues at all of the other 20 children's treatment centers, that transition from a children's treatment center into the adult services sector can be one of the most stressful times of the young adult's life. And so we have certainly worked on making transition into the medical services and other support services a focus now, and are running transition clinics to help with that.
From the John McGivney Children's Center, I'm Kevin McShan for CFTV.